I was really inspired by the experience of becoming a dad and watching how my wife went through becoming a mother. The kids were behind the nursery window, and the dads were all standing outside the window, all of us bawling. I mean, because, you know, and I definitely relate to that. In fact, I think one of my, really my completely favorite experience is being at a birth and witnessing a new family come into being. There's something about that moment when two people become parents, you know, or a couple become parents, or where a mother becomes a grandmother, or where, I mean, just this moment of transition between one thing, which is a mom with a baby inside, now the baby is out and that's suddenly a person. And it is such an amazing moment. I do all of the stuff I have to do after delivery, and we get things cleaned up, and I kind of, just before I always thank the parents for letting me be part of their birth experience, but I get to the door and I look back, and the picture in my mind is always of, like, you know, mom with baby, and usually dad, somebody, family member, but dad often, as close as he can possibly get. And it's just this little frame, this little picture frame of, like, this is family, this is what matters. And so it's super important for me to be part of that. But I often will say, look, I'm never happy until I see that picture at the end of the delivery. Mom with baby, you know, screaming and crying, healthy, all's well. Until that moment, I think pregnancy is a little bit fraught. It's a little bit challenging. And so I don't ever want to be too reassuring, but we do lots of different things. We do early ultrasounds to give a correct date to the age of the pregnancy. Every visit, we listen to the heart rate to make sure that everything's going okay there. We ask pregnant moms to pay attention to symptoms like bleeding, you know, like cramping, that kind of thing. And if you have that kind of thing, we can check it out pretty easily, either by checking the heart rate, doing an ultrasound. So I don't want to be, most pregnancies are fine, but the problem is that early pregnancy loss is also very common. So I get why people are anxious. I'm anxious too. But understand that that's not majority of pregnancies. Most pregnancies go just fine. So we do an evaluation early in pregnancy, or sometimes a patient will come to us with a known history of problems in previous pregnancies. But we do an evaluation that helps to place a pregnancy or a pregnant mom into sort of a risk stratification, right? So either this is a completely normal pregnancy, or we're going to have to do additional monitoring to make sure everything's okay. Interestingly, moms, I think, often feel, because they've been seen every week for weeks and weeks, by the time they deliver, they're often like, well, when's my next visit? I'm like, well, it's not for 6 weeks, unless there's a problem, right? And so we're always there. I mean, common things will be bleeding. Occasionally there's an infection that comes up later. Postpartum depression is a very real issue. Usually happens after 6 weeks more commonly, but it can be an issue right away. And so we try to nip that on the bud because it's very dangerous. Issues with bonding with the child. And so we offer, both in the hospital and then in the clinic afterward, lactation support. Because believe it or not, eating is a learned skill. The ability for a newborn to latch on to the nipple is something that takes some work for both mom and for baby. Of course, some babies also bottle feed, which is fine.